post-COVID pandemic, any new virus that we hear of creates a lot of anxiety. And we always tend to think as to, is this a new COVID? Is this a new pandemic? Who all are at risk? Are we at risk in India? Well, what we require is awareness, and the panic is absolutely not necessary. So in next few minutes, let us understand what this Hantavirus is. Is it a new virus? Is it like COVID? What exactly does it cause? Who is at risk? How to prevent it? And last but the most important, why do most of the health authorities in India consider that we are at a relatively low risk as far as this infection is concerned? So first and foremost, Hantavirus. Well, this is not a new virus. This has been known for several decades. It is a rodent-borne zoonotic disease. So basically, what it means is that it is basically a disease in rodents, mainly rats and mice, and accidentally it spreads to humans. So how does it spread? Is basically these rodents shed their urine droppings and their saliva, which get mixed with the environmental dust, and as these things dry up, they settle down in that dry environment and on the dust. So whenever someone comes in contact with such a contaminated dust, and then on cleaning that dust or in contact with such a contaminated place, these things aerosolize in the air, and anyone who inhales it is at a risk of catching this infection. Occasionally, although quite rare, direct rodent saliva contact with food atoms has also been reported as a reason for spread of hantavirus. Now, what is most important is that human to human spread of this particular virus is extremely rare. Only certain subtypes of hantavirus, like the current one, that is the Andes virus variant, which is commonly reported in South American countries, and which is also the one considered as the one responsible for the current cruise ship related outbreak. This is the one of those rare types where occasional human to human spread has been reported. But what is again important here is that that spread essentially occurs with close contact. So people who are in intimate contact with each other, who are at a closed space like these cruise ships where people have dinner together, play games together, are in enclosed spaces. So there, through droplet spread from the person's saliva, this virus can spread from human to human, but that is extremely rare. In most of the other common types of hantavirus, human to human spread has never been reported. So, what are the symptoms when someone gets hantavirus infection? Well, the most important part here is that the initial part of illness is like any other viral infection. So fever, body pain, headache, nausea, vomiting, sometimes diarrhea and dizziness. These are the common kind of viral prodrome-like symptoms in the initial part of hantavirus infection. Now, a small percentage of people after these symptoms can suddenly deteriorate, and there lies the problem. So basically the new world variant of hantavirus, which is more common in the northern and southern American continents, is the one which is associated with sudden deterioration with respect to lung related worsening, leading to what we call in medical terms as ARDS, where there is drop in oxygen level and breathlessness which suddenly develops, along with occasional cardiac involvement, leading to what we call as myocarditis or drop in blood pressure that happens along with that. On the contrary, the old world variants of hantavirus, which are more common in African and some of the Asian countries, well, these are the ones which lead to what we call as hemorrhagic fever with renal syndrome. So here essentially there is injury to the endothelium which lines our blood vessels and to the kidneys, because of which the person can on one side have low platelet count, bleeding manifestations, and on the other side there can be drop in urine output and kidney failure, which leads to worsening of these patients because of circulatory overload. Now, in both these variants, the symptoms can occur anywhere from the exposure till up to 6 to 8 weeks, which is the fairly long sort of a incubation period. So that is the duration till which somebody with a suspected exposure has to be kept in isolation. So once such a person is in isolation, the spread can automatically be halted. Now, if someone happens to get this, how will the doctor suspect that a person is having hantavirus? So it is not with the usual initial symptoms, because they can be like any other acute viral illness or acute febrile illness. The suspicion basically comes when the patient with a seemingly stable acute febrile illness suddenly deteriorates with either lung related or kidney related worsenings. Now, as far as India is concerned, when any such kind of worsening occurs, without doubt, still complicated dengue, rickettsial infections, complicated malaria, and most importantly, leptospirosis. These are the usual differential diagnosis, all of which remain way more common in our country compared to hantavirus infections. Now, what is important here is not the symptoms of that disease or this worsening, but the exposure history. So, the blood tests or the clinical symptoms are not so much important, but the rodent exposure history is very important. And there again, leptospirosis is one infection much more common in India, which is also associated with similar kind of exposures. So, who are these people who are at higher risk of catching this infection? So, people who work in cleaning old warehouses, farmers, then people working in rodent control, or people who are cleaning closed spaces, old buildings, places which are infested with rodents, and where there can be a contamination of the environment with rodent saliva, urine, or droppings. These are the people typically at risk. Is there any treatment? Well, unfortunately, there is no specific treatment for this particular infection. But what is required is any person who has even slight worsening after initially stable illness should be at a setup where sufficient intensive care support is available. And with a proper ICU care, these patients can recover. So, like as per the available literature of published cases, people who have the hemorrhagic fever with renal syndrome, the ones which affect kidneys, they have around 1 to 15% mortality, whereas people with lung or heart involvement, they have around 40 to 50% mortality. What is most important is this virus is absolutely preventable. So first and foremost, whenever you are going to have any contact with, say, old closed buildings, warehouses, rodent infested areas, not just barely seeing the rodent, of course. So in such areas, dry wiping should be avoided. It should be wet cleaning methods. When you're going at such a places, the person should be wearing proper masks and gloves to avoid any droplet exposures. The room should be properly ventilated before you start cleaning and start disturbing the contaminated dust which has settled in such places. And whenever the person develops any symptoms, instead of self-medication and observation at home, they should seek proper medical advice. So friends, compared to COVID or any other normal viral infections, what is very important is, although hantavirus can occasionally cause extremely serious disease in humans, human to human spread is absolutely rare, and that is what makes this very different from something like a COVID pandemic. So at least as of now, where there is a contained outbreak related to one cruise ship tour, rest of the world, I think there is no pandemic risk at present, and that is what is supported by most of the Indian health agencies and public health related authorities. So we have seen in today's era of social media and rapid spread of information, misconceptions and panic and fear, they spread much faster compared to the actual infection. So seek proper educated information and awareness. Do not panic. Be alert about such potential risks in near future and take the necessary preventive measures. To watch other such informative videos on infectious diseases, please subscribe to the YouTube channel of FeverCare Center for Infectious Diseases. Because like I always say, stay informed, stay healthy.